On the dimensions of equity and human rights, it would be really deeply worrying, because the Zika virus really, particularly in Latin America, affected young, poor women. And I think when you have, I've been to Latin America and I've spoken, with women in the slums, and if you saw the terror and the fright in their eyes and the worry about their babies, it's really unconscionable that we didn't do more in Latin America. I think there was very little response from the World Health Organization. The United States Congress refused to allocate funding, and it was very sad. And also there were a lot of problems with their reproductive rights, because in some parts of Latin America they told women to postpone pregnancy indefinitely. Trump and also the kind of nationalistic populism in Europe and in the United States is exactly the opposite of what we need for global health. Because global health, its very essence, is international cooperation, mutual solidarity, that we're all in this together and we're not placing walls between us. And by saying America first, that means we don't care about others. And that's a terribly sad thing for America to convey to the rest of the world. And I also think that there's some significant risk that President Trump will cut back on global health assistance. The other thing about national populism that's against global health is that it's very antagonistic to international institutions. They don't like the UN, they don't like the World Health Organization, UNICEF. And so really, I think there are some very, very deep risks of the United States putting up walls, disengaging, and not doing its fair share. The important thing is that we have a lot of human rights treaties. We've got and declarations, the Universal Declaration on Human Rights, the International Covenant on Economic, Social, and Cultural Rights, the rights of the child, the Convention on Women. There's so many important human rights treaties, and they all enshrine the right to health, and they all protect the vulnerable, and they're about justice and equity. So we need to use those as tools to fight this national populism. But it's not easy, because the politics are very ugly these days. Most people in medicine and science think that law is peripheral, or it's not very important. But exactly the opposite is true. The U.S. Centers for Disease Control and Prevention, for example, listed the 10 greatest achievements of the 20th century in health, and they were all to do with law. There's so much you can do with the law that's an untapped resource for public health. And we were just showing all the ways that you could advance the right to health. And of course, the signature initiative of the World Health Organization is universal health coverage, which is also in the United Nations Sustainable Development Goals. And you need law and the rule of law for good health systems. You need to be able to finance them, to ensure their quality, regulate hospitals and the professions, and deliver a good quality care. Well, you know, in some ways we're very close, in some ways we're very far. I think it's very close to being successful because everyone's talking about it. And now everybody's saying, well, this rights-based, human rights-based, equity-based, justice-based treaty is a really great idea. And so we're talking a lot about it, and it's changing the conversation in global health toward the right to health. On the other hand, the World Health Organization is very shy about international agreements. You have the United States with Donald Trump that doesn't like international agreements, any kind of international agreement. And so it does face headwinds, but still, it's changed the dynamic in global health, and that's a good thing.